You're listening to 90.8 Hills FM Radio.
This is 90.8 Hills FM radio station, using our voice to make your choice. Stay tuned.
If your skin has a story to tell, make sure it's one you are proud of. Introducing FACE, Facial Aesthetic Center, a unit of Trinetra Netralaya Garchuk Guwahati, your destination for complete skin and hair care solutions. From pigmentation, acne, scars, wrinkles, stretch marks and hair loss, they've got it all covered. Experience advanced treatments like carbon facial, PRP therapy, laser, HIFU, Botox, fillers and more. And yes, all without going under the knife. Whether you want to refresh your skin, restore your glow, or simply feel confident in your own skin again, this is your sign. Visit them at AK Dev Road, Garchuk. Call 920-60-11040 or 986-40-95186. Visit FACE because your skin deserves expert care.
Hello, my dear listeners. Welcome to 90.8 Hills FM. This is your RJ Temsutula. Today in the studio, we have a world-renowned radiation oncologist. She is Dr. Tejinder Kataria. She's the one who introduced India's first infinity linear accelerator with VMAT. She also introduced North India's first integrated brachytherapy unit and initiated stereotactic body radiotherapy. So she has years of experience when it comes to cancer research. With over 35 years of experience, she is also credited with founding the Department of Radiation Oncology at both Rajiv Gandhi Cancer Institute, New Delhi and Artemis Health Institute, Gurugram, as well as establishing the Division of Radiation Oncology at Medanta Gurugram. Ma'am, thank you for coming to the studio and thank you for sparing your time for being here with us.
Thank you for your kind words and the introduction, and I'm very happy to be here with you to take the questions and provide some information about cancer awareness to our listeners to Hills FM here in Dimapur, Nagaland.
Awesome. So maybe we can first start with what exactly is radiation therapy for those unfamiliar, including like me. So we are not aware of what exactly is radiation therapy. Can you please tell us what exactly it is and how is it different from other cancer treatments that we hear of on a daily basis like chemo?
Right, I think that is a very appropriate question to get started. So you have heard of X-rays,
Yes.
which we use normally for doing a chest X-ray or even going for a CT scan. That is where the X-rays are used for diagnostic purposes. And in radiation therapy, the same X-rays which we use for diagnostic are about 150 to 200 kilovolts are actually magnified by a large number to around 6 million volts to 15 million electron volts and are directed into the tumors. So that is what radiation therapy. It's a very high energy of X-rays which is focused into the body where the tumors are residing or the cancers are residing to break the backbone of the cancer, that is the DNA. You understand the genes are the ones which are the culprits for forming cancers and then propagating them. And these genes within the cells actually are encoded with different DNA. And the DNA of the tumor is bound by the hydroxyl ion, that is the OH ion. For people familiar with chemistry, they can understand. And the two strands of the DNA molecule are broken by this high dose of radiation and the tumors get killed. So this is what radiation does.
So let's say like chemo, we hear about a lot of side effects. For example, something as simple as hair loss. Are there any side effects associated with this kind of therapy?
So radiation has its side effects, but they are limited to the area where they're going to get treated. Chemotherapy attacks all the growing cells, the cancers more so, but since the hair are a growing part of the body, the nails are a growing part of the body, the skin is molting every 6-8 weeks. So chemo has more widespread side effects because it goes through the blood and then travels to the tumor. Radiation is focused to the structure, and nowadays we have these VMAT and IMRT and image guidance or stereotactic treatments by which you can focus the treatment to a few millimeters around the tumor. So you mitigate the side effects, but like an area in the head and neck, When you have to treat the lymph nodes also, like for an oral cancer or a nasopharynx cancer, then we may end up causing side effects like difficulty in swallowing. But all patients who receive radiation do not lose their hair, except when we are treating the head area. So radiation does not have widespread side effects. It's only localized, and they are temporary. Start by 3rd week of radiation, and within a month after radiation they resolve. There are no long-term side effects per se with the targeted radiation which is available now.
So, radiation therapy, can it be used to treat all types of cancer? Or
Yes, almost all cancers respond to radiation. Stage 1 and 2 head and neck cancers, cancer of the cervix, they are eminently curable with radiation alone. And in other sites, either surgery or chemotherapy or the newer drugs like targeted and immunotherapy and radiation are used in different combinations to get the cancers out of the body. So there are protocols whereby, like for a breast cancer, woman would have probably surgery first. And if it is advanced, she may have chemotherapy first, followed by surgery. And then without removing the whole breast, we give radiation to preserve the body form and make the cancer go away. For a cancer of the oral cavity, like a tongue or a cheek, they would have surgery first, follow it up by radiation, and they get cured. For a patient of lung cancer, 10% only are operable. 90% of them are not operable. So we do stereotactic radiation there, where we have motion management, where the lung movements are restricted or they are tracked with a machine in the room, and then we target the radiation there and they also get cured. If they are in advanced stage, then they need chemotherapy or targeted therapy. So we use radiation along with the other cancer modalities or alone. For a cancer larynx, that is the cancer of the voice box, they just need to take 6 weeks of radiation, not lose their voice, not lose their swallowing apparatus, and be cured to the tune of 95%. So 50% of the patients, 50 to 60% of the patients would need radiation in their cancer journey. And the patients who are exposed to radiation, 80% of them get cured. So that's the beauty of combining the different treatments synergistically.
would you say that since radiation therapy is a bit more localized than other treatments, maybe it is a little bit safer than other treatments?
Yes, it is quite safe for the patients to come in and take the treatment, and they do not need to undergo anesthesia, especially if a patient has a medical condition like a heart disease or a chronic obstructive airway disease where there is a risk of anesthesia. Then radiation is the modality of choice for their cancer treatment. And there is no bleeding. We have bloodless radiation. There is a technique called stereotactic radiosurgery, and which can be given to all tumors, whether benign or malignant, in the body. And it is going to be given over 5 to 7 days, especially for acoustic schwannomas, trigeminal neuralgias in the brain, or lung cancers which are localized, or metastases which have come into the brain, lungs, or bones, or pelvic tumors which are not amenable to surgery. So these tumors can be very well treated, including the kidney tumors, with stereotactic radiosurgery, and the patient needs to come to hospital only for 5 days. It's called office radiotherapy. The patient comes, takes the treatment, and can go to office also the same day.
Oh.
And it's bloodless because you don't use the knife, and there's no anesthesia. So there's a huge development in the last 30-40 years in the field of radiation.
That's exciting. There's really such exciting news,
Yes.
especially with the increase of incidents over the years. Now, ma'am, you have had a number of experience when it comes to this area. What is the incidence of cancer in the Northeast, in particular Nagaland?
So, Northeast has a higher incidence as compared to the rest of the country. And our average cancer incidence in whole of India is about 100.4 per 100,000 population. Whereas in Aizwal, which is a district in Northeast, and there it is almost 269 per 100,000, which is the highest recorded in the country amongst the males. And in Nagaland per se, it's 124 per 100,000, which is also very high. And if you include the women, then it comes to almost 200 per 100,000 for both males and females. So Nagaland has its shares of high incidence of all cancers, and particularly cancers of the stomach and esophagus, that is the food pipe, lung cancer, and nasopharyngeal cancer. And they are related to the diet, the lifestyle, and the way the food is cooked here, plus the use of tobacco.
Since you mentioned on diet and lifestyle, can you let us know what exactly are we doing wrong? Do you think we are doing wrong that is leading to the increase of cancer?
I don't think I would say that something wrong is done by the Naga people. It's probably the lifestyle or the customs that have been there, especially for cooking the food. One is consuming tobacco and alcohol, and almost 40% of males and 11% of women, they use either smokeless or smoked tobacco. And alcohol consumption is also a part of the natural living here. Along with that, the meat and the food is cooked in a kitchen where there is no chimney. So the wood stove with open fire over which the meat is barbecued is getting exposed to the animal fats and the proteins which fall into the fire and get converted into heterocyclic amines and the polycarbons, which are carcinogenic, and add to that alcohol plus the pickled meat which is kept over a long time. So these are the things which seem to be the carcinogens present in the food and the lifestyle that are responsible for high incidence of nasopharyngeal cancer, the stomach and the esophagus and lung cancer. So more studies need to be done as to actually what percentage of people who get exposed to this kind of living do get the cancer, because everyone who's living or being exposed for a certain small period of time does not get cancer. So there's more that needs to be studied here.
Ma'am, in your expert opinion, do you feel that the kind of utensils that we use, does it also lead to any sort of cancer?
So we would say that we wouldn't recommend cooking in non-steel utensils, because copper can chelate unless it's given a tin polish. Or if you're using aluminium also chelates into the food. So it should be actually cooking grade utensils in which the food has to be cooked. But open barbecued food, we have seen even in the Western world as well as in our own country in India also, that including the eastern states, that barbecued food does expose the body to higher amount of carcinogens as compared to the otherwise cooked food.
We also tend to use a lot of plastic products as well these days.
So yes, plastics have to be banned, not only for the health reasons but also for the sustainability point of view. So plastics and storage of hot food in the plastic utensils, actually in the plastic bottles or plastic carriers, it chelates the plastics, and when you consume the food, you're actually taking those plastics inside. So plastic should not be used either for storing or for consuming food from. So we need to go back to glass and to steel.
Are there any warning signs that people shouldn't ignore when it comes to cancer?
Yes, cancer is a great masquerader. That is the problem, we diagnose it so late. And the symptoms are very innocuous. A patient may have fever which is running for 3-4 weeks and or a month, and they say, okay, it's a viral which is not going away. Patient feels very weak or tired and tries different kinds of medicines, is not getting well. Maybe there is a loss of weight 10% in 6 months, or there is painless bleeding, and they keep taking some medicine or the other without getting diagnosis, especially for the nasopharynx cancer. If the bleeding is coming from the nose, and they would attribute it to maybe a cold or maybe an allergy, and then finally one node appears in the neck, or they're not able to breathe, and then suddenly they'll go to a diagnostic center outside of Nagaland, or in Dimapur they'll come for a checkup and get a scan done, and they'll pick up these cancers. And for ladies, if they have painless bleeding in between the periods, or if they've stopped the periods and then start having bleeding, it could be a sign of the cervical cancer. Or if there's a lump which is painlessly growing. So women do not normally show themselves to the doctors. There's a stigma for having a physical examination done by either the male doctors or going to a physician also. So these are the reasons that they get diagnosed later, and the warning signs are something which may be a headache, which is accompanied with vomiting, and patient may say, I've taken different food, maybe that's why it's happening. But it could be a kind of a brain tumor. So we don't know. These signs and symptoms are there. And warning signs, what we say is like a cold or a cough which has not gone away for more than 3 weeks by appropriate treatment, a fever persisting beyond 3 months, weight loss of 10% or more without trying to lose the weight, loss of appetite, blood from mouth, nose, in urine, stool, or the vagina, that should actually be immediately investigated, because that could be a sign of an underlying cancer. Or a jaundice, which is not related to a viral infection, could be a sign of underlying liver cancer or a gallbladder cancer. Or a lump which is growing in size. So cancer has pain as a very late symptom. People relate pain to cancer, but it comes in very late. So we have to look at these other signs and symptoms and not ignore them.
Based on your interaction with many patients, say women, which has been the most common type of cancer that has affected women in your experience?
So about 40 years ago, when I joined residency in 1985, that time 25% of women, or almost 40% of women who were coming to us, were afflicted with cancer cervix. And now the demographics have changed. So the most common cancer is now breast cancer. And there's a change again in the lifestyle. The cervical cancer was more common in women because there were child marriages were more prevalent. The girls were married off at a younger age. They had more number of children. So that was there. And now it's a delayed marriage. They have less number of babies, and then they don't breastfeed the child. So the demographics have altered over the last few years.
Since we discussed about radiation therapy, and you had mentioned that it can be applied on any types of cancer, are there any misconceptions about radiation therapy that you'd like to clear up?
Yes, so we did talk about the hair loss.
Yes.
That's a big misconception in people's mind, that everybody who takes radiation will lose their hair. So as I explained, it doesn't happen. Then the conception in the people's mind, or the myth, is that they will get burns on the skin, right, which will not go away, or they will get disfigurement and scarring will happen, which does not happen. Nowadays, with the techniques that we have, what is called as mega voltage radiation, you target within the tissue, not on the skin. Earlier with the deep X-ray and lower energy X-rays, you had that side effect, but this doesn't happen anymore. Even if it happens, slight pigmentation that goes away in the next 4 weeks after the radiation. And then there is a conception that radiation is painful. So as I explained to you, radiation is energy. It's high X-ray energy. So that does not cause pain when it is given. If it is close to an area like a pharynx or a swallowing area, then because of the mucositis, the inflammation set up in that area, patient may have pain, which is again limited for 2 to 3 weeks, and that resolves. So these are the misconceptions people normally have about radiation.
Can you give us some general tips that can be applied to any cancer patient post-cancer treatment?
I think that's a very good question, because as we talked about cancer, it's predisposing factors, its treatment. Post-treatment, a person needs a lot of support and care by the family and the friends, by way of not only nurturance and also by way of emotional support, to be positive. That they've gone through a cancer treatment does not mean that it was a death sentence. A diagnosis of cancer is not a death sentence anymore. So people should change their outlook and also support the person who's undergoing this treatment with a positive feedback. And second is they need a high protein diet, which has to be calculated for the body to heal, because once you've treated a cancer, whether by surgery, by chemo or by radiation, the body has to heal. So the healing will come with the high protein, which is almost 1.5 to 2 gram per kilogram body weight of protein which is required, along with the other micro trace nutrients. So fruits and vegetables have to be added to the diet, maybe in a pureed form when the patient is not able to take the solid food, but subsequently as supplements we can give them either in the form of pureed foods or as multivitamin tablets or such medicines, so that they recover. And the third thing is some lifestyle changes. We are all keyed into the digital world all the time, so we don't take time out to be in fresh air, do any deep breathing or exercises. And we also have to learn to self-nurture. So moving away from the digital world or taking a break to nurture the body, which is coming through the quagmire of the cancer and its treatment, that is very, very essential. Adequate sleep, adequate hydration, and kind of deep breathing exercises, so that you get enough oxygen to recover.
Ma'am, you're also associated with North India's first integrated brachytherapy unit. That was your initiative. So what was the clinical rationale behind it when you first introduced it?
So like I said, that 15 years ago, we still had a high incidence of cancer cervix, although it's come down. Even now we have it. And brachytherapy is predominantly used in all cases of cancer cervix, right? And besides that, we have breast cancer where we give brachytherapy, or soft tissue sarcomas where to prevent a limb amputation, we do limb preservation treatments. You do the removal of the tumor and put in the brachytherapy. So in the integrated brachytherapy unit, what you have actually is a fluoroscopy unit and an ultrasound along with the brachytherapy equipment and an operation theater. So the anesthetist comes in and anesthetizes the patient, and we do the brachytherapy application either under ultrasound guidance or do a fluoroscopy to take the position of the sources and do the calculation within that room. So the patient does not have to move out to go to the X-ray equipment area or to a CT scan area. So we do all these within the same room. So that is why it's called an integrated brachytherapy unit. So it minimizes the time for the patient on the table, is more comfortable, and the treatment is over within a few hours rather than taking the whole day.
So how do you envision the future of cancer treatment over the years?
So there's a lot of research which is going on to find. We've been able to hone down not only on the cell of origin, but also the enzymatic machinery and the cell cycle and the gates that open or close during the cell cycle to move the cancer into a division where it will replicate and form more cells, or we can stop that machinery. So that is known as targeted therapy. And then we also engage with the body's immune system, because cancer is not only a masquerader, it is a silent enemy. So it masks the immune system of the body. If you have a viral infection or a bacterial infection, you cough or you get fever. But when you have this cancer growing in your body, it doesn't allow the body to react because it's covered or masked the immune system of the body. So what we are trying to do with radiation, the stereotactic radiosurgery and the stereotactic body radiation, is to give a very high dose to these tumors which break down, and their breakdown products are picked up by the immune system of the body. And then the body mounts an immune attack against the circulating tumor cells. And this is synergistically aided by immunotherapy and the targeted drugs. So we are not only, doing radiation, doing surgery or chemotherapy, we are trying to, like I said, work in synergism to get over the cancer. And the second thing what we are looking at is how to prevent these cancers. We talked briefly about the lifestyle and nutrition, but there are vaccines which are now available to prevent certain cancers. Case in point is hepatitis B vaccine, which can be given to prevent the development of hepatitis B, which leads to cirrhosis and the liver cancer, which is again very common in this part of the world. And the second vaccine is the HPV vaccine, which is given to girls now. It's available in the country, and India has proudly manufactured its own cancer vaccine for cervix, which is given in 2 to 3 doses to girls from the age of 12 years to the age of 26 years before the first intercourse. So if it is given, then it prevents the HPV infection and prevents the cancer cervix from developing. And the HPV vaccine is also recommended to males, because we have started seeing patients with HPV positive oropharyngeal cancers, that is the cancer of the tonsil and base of tongue, and anal canal cancers because of the lifestyle. So those can be prevented in males also if they are given HPV vaccine. So we are not only looking at curing the cancer when it comes, but preventing it by lifestyle changes, by adding the vaccines. And the third thing is screening program. So that is how to detect the cancers early. So for that, for a breast cancer, which we said was very common amongst women, setting up a mammography unit, which is a digital X-ray unit dedicated to do the mammography and pick up very small cancers, as small as 2 to 3 millimeters. And then the patient doesn't need to have the breast removed, doesn't need to undergo chemotherapy, doesn't need to have all the targeted drugs and everything. So it can be picked up. And if you do a self breast examination, a woman can pick it up to a size of maybe 3 centimeters. But here you are comparing 3 millimeters in a mammography, which can be very easily set up. And that is a screening tool. Then for people who are smoking, doing a low dose CT scan at regular intervals can pick up ground glass opacities and the cancers when they're 5 millimeters or 10 millimeters, rather than having a stage where you can't operate them. Like I said, 90% of them not operable. And the third thing is about the pap smear. Pap smear is recommended for any woman who is more than 10 years of sexually being active. So pap smear for 3 years, once a year, has to be done by all women. And then if there are any changes, they can be managed by early cauterization or colposcopic removal of that early pre-cancerous stage, and you prevent the cancer. So you do the screening. One is primary prevention, that is lifestyle changes and the vaccination. Then secondary is by screening, and tertiary care is of course the treatment. So we are targeting cancer care from all the fronts.
Mm-hmm. Ma'am, speaking of vaccines, be it HPV or hepatitis, is there like for both male and female, is there like an age limit for it?
So again, hepatitis B should be introduced in the age of adolescence, because most of us go and give the blood transfusions also, blood donations, and it can be safely given to children above the age of 5 years, hepatitis B vaccine. And for HPV vaccine for the adolescents in the pre-teen age, 12 years you start, and it can be continued up to age of 26, because by then they would have been exposed to it. So that's the rationale behind it.
Mm-hmm. And like you've mentioned, both male as well as female are
Yes.
eligible for HPV.
Both for HPV and hepatitis B also.
Mm-hmm.
So you give it to the girl child also.
Mm-hmm.
Hepatitis B can happen to a girl child also.
How about screening? Is there a particular age limit for screening?
So for the screening, like I said, for the cervical cancer screening, you start 10 years after the first intercourse. And for the breast cancer, the recommended age is 45 years. Because before 45 years of age, the breast is very dense. And if there is a family history, then we would ask them to have an ultrasound. Or if there's a very high risk, then we would ask to do a MR mammogram. That is an MRI-based mammography. But above the age of 45, every 2 years till the age of 50, and after the age of 50, every year till the age of 65. So that is the recommendation for mammography screening. And for the low dose CT for the smokers, if they are more than 10 pack years, that is if they smoke 1 pack of cigarette per day for 10 years, that is called as 10 pack years, then they should undergo low dose screening with the CT scan.
So,
And besides that, there are two more
uh-huh.
screening programs. That is endoscopy, upper gastrointestinal endoscopy for picking up early stomach cancer and the esophageal cancer. So it was very common in Japan about 40-50 years ago. So they started in their executive health check, started screening everyone, and their cancer esophagus rates have come down drastically. So they've been able to control cancer esophagus by just screening. And the second is lower GI endoscopy, that is colonoscopy, to pick up colon cancer. So that is to get started by the age of 50 years. And depending on your family history, it has to be done either yearly or every 2 yearly. And fecal occult blood. So that if there is blood loss in the stool, that can also pick up these polyps which are precancerous in cancer colon. So these are the 5 definite areas where we should be able to offer the screening program, and they are age based.
So, a very generic question. In your opinion, is a cure for cancer within reach?
I would say it's already arrived, and there are many patients who are cured of cancer, provided they are picked up in stages 1 and 2, where the cure rates are to the tune of 95%. And in the stages 3, the combination of treatments, we are able to offer cure to the tune of 75 to 80% of patients. Stage 4, again, varies between 25 to 50%, depending upon the site, depending upon the type of the cancer, and the time when the patient comes to us. So we are almost all there, but then we do need a lot of inputs, resources, and patient awareness or public awareness about this disease, because this is a disease which is again seen in the aging group. There are children or young adults who are afflicted, but as we accumulate more and more environmental, toxins in the body, and we age, after heart disease, cancer is the second most common cause for death going to be.
I've had one nutritionist who had actually told me that we should always stay, as much as possible, stay away from food which are in packed form.
Yes, because the food preservatives and the chemicals used to keep the food fresh are the ones which are carcinogens. Because if you consume the fresh food and you leave it out, it'll get spoiled, right? So you preserve them with some chemicals, and they are the ones which cause the food to become carcinogenic for your body. So that's why packed foods and all these aerated drinks, they are also not good because of the additions that are done to them.
I believe this interview has been more like a free consultation. You have given your free advice, knowledge for free, and I on behalf of everyone who is listening, is so grateful for your inputs.
Thank you so much for having me here. And if I can make a change in the perception about cancer, or kind of inspire some people to come forward to take their vaccination and speak to young people about prevention of tobacco, not taking tobacco, reducing the alcohol, and doing the screening programs, and learning that cancer is not something which cannot be tackled or cannot be cured, I think my interview would have been very successful. Thank you for having me here.
However, before letting you go, I have one last question. For all those who are aspiring to enter oncology or any sort of medical sciences, what advice would you give them?
So I would advise them that they should come in with an open mind and be prepared to learn, because this is an ever-changing field. There's so much of research which is happening, and they should have a kind of dedication and empathy to look after these patients, because they do need care for a longer time than a normal patient. So you may continue to see your patients over years, and it's a continuous spectrum of disease which may evolve. So you have to be mentally and emotionally prepared to take that when you attend to such patients. So I would advise that anybody who's willing to come in should be ready for a long haul here.
Awesome. Thank you so much, Doctor, once again for being here, for sparing your time and sharing your knowledge and input.
You're welcome, and I'm grateful to Hills FM.
Also, ma'am has some very wonderful news to share with us about a certain doctor who will be available in Dimapur, madam.
Yes, and she is Dr. Sorun Shishik, a consultant with us at Medanta, and she is available once a month at Dimapur to have a consultation regarding cancers. You can reach out on her number, and my colleague here in Dimapur knows where the clinic is, so she's going to come there and provide the services.
So for the listeners, make sure that you take advantage of this opportunity. You can reach her at this number 81369 13866. I repeat, 81369 13866. So our lovely doctor has not only shared her input, personal input also, she has also given us some very valuable information, especially for the ones staying in Dimapur, to avail a consultant from Vedanta. And once again, I repeat the number, 81369 13866. So thank you, doctor, for that as well.
You're welcome. You have a good day. Bye-bye.
All right, that was the very lovely Dr. Tejinder Kataria. She and her team, who has contributed so much to medical sciences, in particular cancer research, let us, the public, also support them by being more aware of our lifestyle choices. So my dear listeners, that was Dr. Tejinder Kataria. I hope you enjoyed listening to her as much as I did. Keep listening to 90.8 Hills FM.
Are you ready to build a career rooted in growth and opportunity? Admissions are now open at Daffodil College of Horticulture, Agriculture and Technology, affiliated with Assam Science and Technology University. Whether you are passionate about plants, food production or modern agriculture, this is your chance to pursue a BSc Honours in Horticulture or BSc Honours in Agriculture. At Daffodil, you don't just study, you gain hands-on experience across 30 plus acres of practical fieldwork. Learn from expert faculty, explore exciting job opportunities with many students already placed through campus interviews. From a well-stocked library and modern hostels to a vibrant campus life with sports, seminars and more, Daffodil has it all. We are located at Khetri, Kamrup, Assam. For admission details, call these numbers 98543 23400 or 98540 51202 or email us at daffodilhorticol@gmail.com.
You're listening to 90.8 Hills FM Radio.
This is 90.8 Hills FM radio station, using our voice to rate your choice. Stay tuned.